Hi, everyone, and welcome to our Thursday practitioner call. We have this every Thursday at 9 a.m. Pacific, and this is really a roundtable discussion with our doctors and with our practitioners, and of course, the clients of our doctors and practitioners. And we, of course, talk about X39, the stem cell activation patch, but we usually go a little deeper in this call, and we talk about a few of the other patch technologies, because as doctors, we know that you have lots of tools in your box, and you would want to know how to use the different tools. At the end of the call, we also talk a little bit about how practitioners are setting up their offices so that patients can get the protocols quite easily. So welcome to the call. We're so happy you could be here. Oh, and lastly, we do go to some of the informational sites and show you where you can look at the research so you can understand patents, research, how GHK copper peptide works, for example. So we do all of that on Thursdays. And blessed to have Dr. Patty here today. She's an MD from San Clemente, California. She can't always be here because she is with clients a lot of the time. And so it's always a treat when she can pop in and talk with us. So we're always in gratitude about that.
Thank you.
Yeah, yes. It was really Dr. Patty who about 3 months ago, we had a conversation, and she just said, you know, there's some different protocols that I'm using that I like. I like to know how we can best set up my office so that I can get everything out to my clients. And it was really Dr. Patty that helped me with her create what doctors may need for some of the different protocols. So I don't know if I've ever told you this, doctor, but thank you for giving us the vision of what practitioners may need. So with that, why don't you tell everyone just a little bit about yourself and why you are, how you learned about the stem cell activation patches and why you are supportive of this technology.
Well, thank you, Marci, and it's good to see all of you again, and then some of you are new. So welcome. I was new myself about 6 months ago, so I'm pretty newbie on the block too, and I just appreciate what Marci and the team do to respond to us. Karen is my immediate mentor at Lifewave and has been so responsive. Marci, it's like everybody is together because we want success for all of us, for our patients, our clients, and everyone. And I learned along that line, I learned about Lifewave through a patient of mine who was having some pain, jaw pain, and was getting success with using Icewave patches and X39. And I'd never heard about Lifewave. And when she began to talk to me and tell me how helpful it had been to her, I got sort of excited because I had been using stem cells and peptides and the very things that the X39 patch does for us, only in a much more cumbersome and expensive way. And so I was excited to learn more about it. I was surprised that it could really work. And so I began to just deep dive into the research and over 80 studies, 70 to 80 studies, and listen to David Schmidt and all his work and webinars. And I realized that there was science behind it and that it was very safe, and in medicine, we call it efficacious, meaning it's effective. So that's how I got into it.
Well, let's talk a little bit about the two patches that you actually heard about from your patient. It's the X39 stem cell activation patch, and it's Icewave. And Icewave is it reduces pain. So let's start with X39. Now, if you look inside what one of these look like, it is like a patch, almost like a sticker or a Band-Aid. And inside is this organic crystal. If you're new to the call, it's that white material. And it turns out that this is a form of wearable light technology. Dr. Patty, can you explain a little bit about light and wearable light technology, red light technology. What is this new thing called light in medicine?
Well, this is what to me is just the most exciting thing of all, because our body makes and pushes out, emits infrared light. And we know that that is a healing frequency for our body. If many of you may have gone to a gym that has an infrared light bed, or gone to a physical therapist that has a light that emits infrared light, a wand that emits infrared light, to put on a part of your body that's hurting to help heal it. And so what we do with the Lifewave patch is we harness our own body's beautiful healing properties, and we put that patch on a spot in our body, a designated spot that's an energy meridian that David Schmidt and his research team have studied. And that blocks that light from going out, and it comes back in right at that spot where Marci was mentioning about the organic crystals. And we then utilize that light in an even deeper way for healing for our body. And it stimulates our body to make a peptide called GHK copper. And that peptide stimulates our body to make more stem cells and to use the stem cells we have in our body more effectively.
Wow. And I've heard you say this word before. This patch is a form of photobiomodulation. What's that mean? That seems to be a very big doctor word.
It is. And so you have to sort of see it in three groups. The photo has to do with the light, and then the bio, meaning our body, and modulation. So we're slightly taking what our body makes and does naturally and just giving us a little more oomph of that back into ourselves as we need it. And so therefore we are using light to affect our body in a very positive way.
Wow. And you said that the X39 patch activates your own light to activate a peptide called GHK copper peptide, which then activates your own stem cells. Can we break that down a little bit? What is GHK copper peptide, first of all? And is that something that doctors are using?
Yes, it is. And a peptide is just a short chain amino acid, and it's something our body makes naturally. GHK copper is actually being used. I'm a functional medicine doctor, and in the integrative world, we're using that as an injectable peptide. And people literally for 1 month will buy little tiny insulin syringes and inject GHK copper peptide, usually sort of pinch up a little belly fat right there in the belly. And they do that for a month. And that sounds like a lot of work. And some people are willing to do that, but others aren't. But those that are, and I have done it myself, it is very beneficial. It is definitely a repair and a regenerative peptide in our body. So if you can, when I learned that you can bypass an injection and use a simple patch every day, 12 hours on, 12 hours off, it's just very much an exciting, I think, something that's been brought to us as practitioners to be able to use in our practice for our patients. They don't have to come in, they don't have to use a needle. It's about 1/3 the cost of those injectable peptides, and yet naturally they're getting more of that activated in their body just through the patch's light and our body's light.
And let me understand that. So you used to, as a functional medicine doctor, so that functional medicine, regenerative medicine, so you're an MD in regenerative functional medicine. So at root cause, trying to help us stay youthful and without situations, so to speak, right?
Right. Our goal is regenerative medicine, functional medicine, integrative, holistic. There's a lot of different words out there. But our goal is to try to get to the root cause of whatever kind of inflammation or problem our body is having, and to utilize our body's healing properties and support it sometimes through supplements, sometimes through natural bioidentical hormones or peptides that our body naturally makes. Exactly.
So let me ask you this. You talked about that you, as a regenerative doctor, used to do injections of GHK copper peptide every day, small injections, costly, but GHK copper peptide has a lot of healing benefits. So that's why. So my question is, this patch does this have GHK copper peptide in it? Is it, or what is, people always talk about non-transdermal versus stuff that is transdermal. Like, I guess I'm kind of confused. How does that work?
It is. It's something almost impossible to wrap your head around initially. And I was the same way. But there is nothing, no drugs, no chemicals in that patch. And what makes that so beautiful is, I'm sure all of you, or at least most of you, are like me, and that we treat patients and clients that are very sensitive to medications and to even supplements and herbs. And so we have to proceed cautiously. And this is me. I'm like the ultimate sensitive person for everything. And so when I found out that there literally were no drugs at all in the patch, it was stimulating my body to make what it makes naturally, just giving me a little more of that. It made me feel very excited, because I always look at safety and efficacy. How effective is it? What's the risk? And is the benefit, the effectiveness, greater than the risk? In this case, the risk, it's safe. There's not a risk per se, or minimally, maybe if you got a little rash at one spot and you moved it to another spot, but basically the safety is there, and the effectiveness has been proven, not only in case studies, but also in some actual research.
You know, let's talk a little bit. I wanted to dig a little deeper in GHK copper peptide for our practitioners, and then we'll go into how it makes takes stem cells out of being dormant. For you practitioners, you can always write this down and do your research later, but I'm going to show you some great tabs. Please write down startx39now.com. That's startx39now.com. And what you'll find, we've been talking with Dr. Patty a lot about this GHK copper peptide and how she used to inject it. But now she uses the X39 patch, non-transdermal, see if I get this right, using light that you wear to activate your own body to give you just the right amount of GHK copper peptide that your body would need. And let's just look real quick. What I believe this is the reason why Dr. Patty was injecting GHK copper peptide and now moved to the patch is, look what it does. It reduces fine lines and wrinkles. It tightens loose skin. It reduces photo damage. It actually protects the skin from UV radiation. Look at this one, increases hair growth, and it accelerates wound healing. As it relates to anti-cancer actions, it's the #1 recommended molecule for treating metastatic colon cancer. It helps to reset programmed cell death. Those are cells that are fast growing. Can you mute, please, Jan? Thank you. That should be in control, but they're not dying like they should. So that is something really important. It actually repairs damaged DNA. It actually helps for inhibiting growth of cancer. Look at lung protection. It helps with chronic pulmonary disease, restores healthy function in COPD affected cells, protects lungs. Very interesting. Let's go look at anti-inflammatory. It basically reduces something called oxidative stress in the system, which is free radical damage. That's the whole reason you take antioxidants. You know, an apple a day keeps the doctor away. This would be like apples on steroids, right? Brain and nerves. Look at what it does for neurofunction, reducing anxiety and aggression, anti-pain activity. And then stem cells, we're going to talk about this more closely, but it increases your dormant stem cells, which, by the way, by age 60 are almost all dormant. They stop, they're not dead, they just kind of go dormant. They stop working. I like to say they go on vacation, and we'll talk about why they need to start working again. And so, and all about, I thought this was very interesting. Additional actions, helping with the linings of things, stomach, intestine, bones. My guess is because it's activating collagen, and collagen is in every single connective tissue in the body. It blocks cortisone, which is the chemical that starts inflammation. It reduces fibrogen, which is, I believe, scarring. So, I mean, I see now, doctor, why you were giving GHK copper peptide injections. I mean, it's pretty clear when you read that. Like, wow, that would be like getting at a lot of different root causes. Yes, is that kind? Am I thinking that right?
Right, and that's why it's so popular in the biohacking communities, because they see such regenerative effects. It helps them with better workouts and better recovery from workouts, and just sort of turning back the clock, you know, which is what we love if we can do, so that we feel better and have more energy for life.
Wow. So let's talk a little bit about the other piece of GHK. It was in that document at Start X39 Now, NOW.com, and there was a little tab called GHK copper peptide. This peptide is also, it acts as a communicator to your stem cells. And we just explained how stem cells go dormant by the age of 60. Doctor, what are stem cells, and why are they important to not go dormant?
Well, most of you know quite a bit about stem cells, sort of sometimes when they're in the media. And those are a different kind of stem cells. Those are embryonic stem cells. Those are stem cells that we, from the very beginning of life, can convert into anything we need in our body, whether it's a head or a finger or whatever. The kind of stem cells we're talking about now as adults, and if you go back and look at that document, you'll see that it uses the abbreviation MSC stem cells, and that stands for a word called mesenchymal stem cells. Those are the kind of stem cells we have as adults. And when we're a baby, we have millions. By the time that we're 30, we have half that number. And by the time we're 60, we have a few, but not very many. And the ones we have don't work quite as well. And what I mean by that is stem cells produce lots of growth factors, anti-inflammatory compounds, and they help to keep our body youthful. They help us to repair our DNA to prevent cancer and all those things that happen as we get older. And so the stem cells that we're really stimulating in our body are these mesenchymal stem cells. And we call those stem cells the multipotent stem cells, meaning that they are not going to turn in another head for us, but they are going to help regenerate and repair parts of our body that need repairing.
So let me think about this. So I'm not a doctor, but I'm just trying to process as more of a client of a doctor what's going on with me. I'm 55, and my stem cells, these special stem cells you're talking about that adults have, the MCS, I think I did the abbreviation right. I might not.
MSC.
MSC stem cells in my body are kind of like, I don't have that many and they're dormant. So I take this X39 stem cell activation patch, which through light activates GHK copper peptide. That peptide acts like a telephone to these MSC stem cells and tells them to start marching again, to make more of you again. And let's reset them like you're 20 again. And then my stem cells, because they get the call from GHKcu peptide, kind of wake up and they start a rocking and a rolling through my body. And they go to wherever my body needs to be repaired first. And I believe it's really where you have the most inflammation, because that's like the body's sign that it needs to go repair something. And it will turn into whatever cells you need to repair it. Once that's repaired, it's going to go to the next thing in repair, and then the next thing in repair. And so for me, just being kind of like a layman, I think about, and we have, I think about when I was 20. I don't know about you guys. Maybe you can think back then. Some of you might be 20, but if you're not, think back when you were 20. Did you have gray hair? Did you have wrinkles? Did you have that chronic thing that you have now? And most likely the answer is no, because we were repairing, like our stem cells were repairing. So I like to think about, like, what if I could turn the clock back? What if I could repair like I was 20 again? What if my skin could start feeling elastic again? What if my hair didn't get as gray? You know, those are the kinds of things that I think about. And what I have found, doctor, is I have been on X39 for 3 years now. And I don't know how many of you have been on this call and for how long you've been on the patch, but I'm 55. I look at pictures when I was 45, and I look younger today than I did when I was 45. Something, Dr. Patty, is going on here. And I would just love you to kind of expand from a doctor perspective, like what I think is going on. I mean, let's just call it what it is. I think I'm repairing like I'm 20 again. And I think it's like almost too good to be true, but it really feels like that's happening. Can that really be, is that possible, Dr. Patty, from our regenerative MD? Can we really be turning back the clock? Is it possible?
I think it is possible. And I have studied stem cells now for about 5 years, very extensively, and just read everything I could, all of the medical research around this, in addition to other things that are out there. And I'm not providing any advice or treatment or anything, diagnosis, anything like that today as a doctor. When I talk to you guys, I'm just telling you what I've learned, my experience with myself, my family, my patients. And I do believe, I'll give you a perfect example. I went to the dermatologist yesterday. I had this one little spot on my inner ankle, and I just wanted him to take a look at it. I really thought it was okay, but I thought, I'm just going to make sure. And he ended up, of course, doing a full body inspection. And when he finished, he said, "You really look great." And he said, "And you say you grew up in Texas and you've lived in California?" And, he said, "Your skin really looks good." And I thought, yeah, I think so. And I think it continues to get better. And the reason is I've been doing stem cells for a while now. And I was doing them through IVs and injections before the FDA said that we can't do that in the United States any longer. And so now you have to go to another country. But that stopped about 1.5 years ago, which is why I was so excited to learn about patches and that we could still have this option. So I think it's very definitely true, Marci, that we can provide regeneration and repair. I've seen it over and over in patients and in myself.
Wow. Regeneration and repair is possible. And I also think it's very interesting that to get stem cells now, you have to go out of the country. Or you can put the X39 stem cell activation patch on, and through light, activate your stem cells through activating the GHK copper peptide. So what a great alternative now, doctor. And it costs less than a cup of coffee a day. It's just, it's so simple that you try to make it harder than it is. And what do I mean? You unstick it and you put it on your body. That's it. That's what you do. And you wear it 12 hours on to activate and repair, and 12 hours off. Most people put the X39 right below the back of the neck or underneath the belly button. but really any spot will do, because as Dr. Patty says, we emit a low-grade infrared light off our entire body. You know that's truth because you have seen night vision goggles. You've seen people be able to see people at night with these night vision goggles. That's the low-grade infrared light that those night goggles are picking up. This just reflects it back into you and activates your body. Photobiomodulation. It's kind of the same way when you go out into the sun and you activate vitamin D in the body. Light does make change to the body. This wearable light technology that David Schmidt, the owner, inventor, and CEO, created happens to reflect back your own light. So remember, you don't have to be out in the sun for it to work. You can wear it at night. Your body radiates light 24 hours a day. So this should only be worn, however, 12 hours on to activate and repair, and then 12 hours off, because it is a signal. It's light. And if you wear it 24 hours over and over and over again, your body gets used to the signal and it doesn't work as well. So the only rule is 12 hours on to activate and repair and 12 hours off. And just a brief history about our company. Lifewave started in 2005 when the Navy SEALs called David Schmidt and said, hey, we know you're an inventor. He actually invented some things for them as it relates to submarines. And they remembered that his technologies were really good. So they called him up and they said, hey, could you figure out a way to keep our guys up at night without stimulants? And David started, and it was actually this patch in 2005 called the energy patch. This patch actually converts fat into energy, and it actually increases the mitochondria in your body. And the mitochondria is the powerhouse, you ready for this, of every cell of your body. And so this particular patch is kind of cool. It's a 2-patch system. And you put the energy patch, the white on the right side, and the left, and the tan, you see this one's tan, on the left side. It's almost like, have you ever seen those battery chargers on your car where you got to do a positive and a negative and it charges your battery? Think of energy as charging the battery of your body. Is that so cool? So this patch basically was the beginning of his company in 2005. And let's face it, he was way ahead of his time. David Schmidt, I like to say, is this combination of literally Tesla and Iron Man. And by the way, if you ever meet David Schmidt, you will find out that Iron Man is his favorite superhero. That's kind of cool too, if you really think about what Iron Man does, right? And so let's actually think about that. The company started with about, I think they were doing about 30 million a year. And it was a little company because nobody understood light in 2005. And then what happened? Well, he started building out countries, warehouse facilities, distribution. Did you know all the organic crystal in every one of his patches is made vertically in the lab? I think that's pretty cool. He has complete control over distribution and manufacturing, is called vertical, which is very important, especially in today's times where there's so much, I guess, not so much stability right now all over the world. So it's nice to know that this is stable, right? Well, in 2018 is when the X39 came out, and an interesting thing happened. It was like this beautiful marriage of people were realizing that light was real. I mean, MDs like Patty were using laser, infrared, red light sauna, right? Cold laser. It was being used. And then this idea of stem cells as regenerative started to appear. So since 2018, our company has done about $400 million a year. So you can tell that the business, we've just now been able to help so many more people. And we also have a patent on X39, and I'll show that to you guys so the doctors can see this. Once again, you just go to startx39now.com. That's startx39now.com. And do you see under here, research and patents? I love this site. This right here shows you the patent, and it explains how and we need to mute, how X39 activates GHKcu peptide in the blood and how that actually activates stem cells. Of course, you can't get a patent if you don't prove that it works. So pretty excited about having that patent. If you want more information and to research, I'll just show you this site. This site is a 1-minute video on how light works. It's our very video number 1. This is a 3-minute video about how stem cells work. And then this, I love this video. And if you could mute, please. And this is a 18-minute video where David actually explains how photobiomodulation works and the issues that the X39 helps with. And then for practitioners, you will love this video. This is David talking. It's video number 4. He actually goes over all the research with health practitioners. So you'll definitely want to see this. And then this actually talks about the other products in his line above along with X39. And people really like this one page on all the patches. And also, this was Dr. Patty's favorite thing she did for research. She went to YouTube, Lifewave Health, and she just searched David Schmidt and every technology. Did you know David does a deep dive for 1 hour on every single patch technology? And lastly, horses don't lie. This is AccuLife. We're going to talk about Icewave in a moment, which is basically AccuLife for humans. But of course, David created Icewave, which is phototherapy for humans, and AccuLife for animals, really because in the world of humans, light therapy is an acceptable therapy, but in the veterinarian community, it's actually to be accepted in that community, it needs to be acupressure. So basically, for example, the AccuLife, if you look at this video, will show these horses that are in distress, and you know that because they quiver. And within just a few minutes of AccuLife, the quiver goes away. I'm very excited about this because it was this video that one of our vets saw just a few weeks ago, and she now has asked to set up AccuLife in her office, AccuLife and X39. So it's exciting when doctors see what we have, when vets see what we have, because I believe that we can help more people as those communities start to see the technology. Dr. Patty, what's your view on all of this?
I think that it's remarkable to have something safe and effective, something that we can use in today's time. These products can be drop shipped to our patients and clients, which is so convenient for us as practitioners and for our patients. They don't have to come into the office. If they're traveling, all they have to take is this little, I was out of town a couple of weekends ago, and it was so simple for my husband and myself. We were both traveling together, and I just literally put our patches in, one of the patch envelopes, and we had them for the weekend. They take up no space at all in the suitcase. Literally, it's wonderful. And so it makes it usable. And part of our problem with supplements and things like that is they have to go through the gut. Often people don't absorb them well. They have reactions. With a patch, you're not going to have those issues. And and can trust that they are working.
Let's talk about that. I don't know about you, doctor, and I've been feeling a little guilty about this. But for some reason, I used to be the girl that had 2 bags of supplements. Like, I seem to take only 2 now. And I'm kind of thinking of stopping my auto ship on a couple others. What do you think I can get what I need for light therapy? Because swallowing all these pills now, once I've used this technology that's so simple, I'm kind of struggling with, to be honest with you.
Yes, I think that often as functional medicine doctors, we can start making supplements the holy grail. And I think that lifestyle is our most important foundation. And that includes, and David Schmidt is big on this. We have to be eating right and exercising right. That's our foundation. And we can do a lot of other things on top of that. But if we don't have that foundation in place, we're going to struggle. And then after that, the patches make so much sense. David Schmidt also talks about often having, certain supplements that might be important, maybe some nutrients and minerals, maybe a good multivitamin. I use Daniel Amen Brain and Body because some supplements for the brain and the body. So I think we support our body, but then we don't have to be always taking what everybody else says is important or what we read or someone tells us is good. We know that we're being supported in ways that are much easier, and we don't have to spend a lot of money on many superfluous supplements for sure.
All I can tell you is that my son used to tell me he could buy a used car with all the supplements I take. And I'm just not doing it so much anymore. And I feel better today than I felt, the last 5 years. And so I'm just so thankful.
Yes.
Let's talk about Icewave. Now, this is one of your favorite patches. Could you explain kind of what your story is, why, and also how you wear these patches? This is a 2-patch system as well, like energy. So let's talk a little bit about Icewave.
Right. So Icewave was important to my patient and got me going because I have multiple sclerosis. I like to say I have the symptoms of that because I don't identify with that disease. And so I do have chronic pain, and it's especially bad at night. At night, our cortisol levels drop, and that sometimes then makes us feel worse at night. Many of us have that issue. And so when I heard about something that didn't have any medicine in it, as we all know, pain, chronic pain, acute pain, we all suffer from that at some point in time. And we know that it's stuff you have to take, and it usually makes you not feel good, and it can be very depressive to our systems. The idea that there could be something for pain that literally has no medicine or chemicals in it, but it activates our own body's responses and works in a way that interrupts those pain signals and pain connections. I just couldn't believe it would be true. But the first night I used the Icewave patches, I had about a 50% reduction in my overall body pain. And within 2 or 3 nights after that, it reduced to about 80-90%. And that has been sustained now for 6 months. It's very special.
That's so exciting. Let's talk about placement of Icewave, because people ask a lot about Icewave and how to place Icewave on the body to get at pain. And I like to say, or I read in it that David explained that much of the pain we have is in our connective tissue, which makes sense because connective tissue is throughout our entire body. And so he says that you put the brown patch like where it hurts the most, and you could put the white patch like 3 inches away, and that breaks the connection of pain. So as an example, I think some of you know I broke my wrist, and it still hurts sometimes quite a bit. So I'll put the brown patch right there, and then I'll put the white patch like 3 inches away. And so that could be like that. And then I would put like an X39 right here. And that's going to be my repair. It's almost like my bracelet around the wrist. I like to say my spot of pain right now is my wrist. So I'm going to pop the spot. Now, that could be if your spot is your shoulder, pop it there. If your spot is your knee, pop it there. You can wear more than one of these. So you can pop both knees if you want. Or you could get at full body pain, and I like to say you can bookend it. So for example, Patty has bookended her full body pain, and maybe you could explain how you would do that, Patty, doctor.
Sure. So it's recommended if you go onto the site, our website will give you a lot of information. Scroll all the way down to the bottom of the Icewave patch page, and it will give you usage. But if you have whole body pain, you do it a little differently. You put 2 on your bottoms of your feet and then 2 up on your shoulders or at your elbows or wrists. And it sort of, I love how Marci says it bookends the pain. And you use always white on right, left on brown on left. And so white on right under my right foot, brown on left under my left foot, and then same thing, white on right and brown on left on my shoulders.
Wow. And that was a bookend. So she had it at the bottom of her feet and her shoulders. And how did that help on the pain? How much pain, how did it do, doctor?
So they gave you several different places to try the upper bookend. It's always on the feet, the bottom bookend. And so the first night I tried it on my wrists, and that's when I got about a 50% reduction. But it was just so amazing. I couldn't even believe it. And I thought, yeah, well, that probably won't, last or whatever, or maybe it was just a one-off fluke or something. And so then the next night I tried it here, and it was about the same. And then the third night is when I moved it to my elbows. And when I moved it to my elbows, it reduced it about another 30+%, so 80% at least. And then over the last few months, I've sort of experimented a little bit with it. And ultimately, I alternate it between my shoulders, which usually gives me about 90%, and my elbows. I have had a few nights of what, in medicine we call breakthrough pain, and my hips. My hips are the worst part. And I then got and put a white on the right hip and a brown on the left hip. And then that knocked that out. So sometimes I'm patched up, but let me tell you, it's amazing. Most nights I just use the 4.
Wow. So you sometimes when you have breakaway pain, you'll put 3 sets on, or a total of 6 Icewave, because her pain, she's bookending from her like shoulders to her toes, and then the hips hit, and she just did a little touch up on the hips. It's interesting that you say that, because when this was at its worst, I was double ice waving on it, and it's so funny. You think, oh my goodness, that's a lot of patches, until you hurt. Then you're like, where are those darn patches, And what's pretty funny is that how it really does just take the pain away. And it is 12 hours on, 12 hours off. So I have to say, my pain was so bad at night that I was wearing Icewave at night. And in the morning, when I knew I had to take them off, I was so sad. I'm like, oh no, I have to take them off.
Well, I found that I get residual during the day somewhat, and my pain's not as bad during the day too, so it's a combination. But occasionally I've forgotten to take them off the bottom of my feet, and so then that night I don't put them on. That happens to me probably about once a month, and if that does happen, that next night I'm okay, but I could tell that I need it again after that. So we get a little bit, I think, of residual with it. But think about it. We have surgery in my situation because part of my pain is caused from muscle spasm. People literally get injections of Botox to paralyze their muscles, so then they can't walk. But the pain is so bad, they do that. If you could put on Icewave patches and you're still walking, moving, working, look at me, of course you're going to be fine to put on 4 patches at night and occasionally 6 if you need that, and without having to have any bad intervention in another way.
Wow. I didn't even know that was the alternative, doctor. Wow, that's quite an alternative. Yes. So I have a few other, we have time. Let's talk about a few other patches. What do you think of this one, Aeon, and why do you wear it, and why do you like this one?
I use Aeon at night, most nights, but you can use it day or night. And I know Marci always likes to call it the gentle giant. It's wonderful, and it truly helps you to reduce inflammation. And so it's a great combo in synergy for X39 because we talk about stem cells being honing birds. They go to the areas of greatest inflammation. So you want to have the least amount of inflammation in the body so the stem cells can really work well in all areas and have lesser areas to have to work in. So the Aeon is a great companion to reduce inflammation in the body. And of course, that helps with pain. And that's one reason I wear it at night too. It's very helpful at night for me.
You know, I always say that X39 and Aeon are the workhorse of the line, with X39 being the first and Aeon being the companion. As David has said, that X39 activates stem cells, but inflammation is an eater of stem cells. So if you can knock the inflammation out with Aeon, you can turbocharge the X39 to work even better. And so for me personally, always wear these together, but Aeon also is the gentle giant, which means that it can put your system in rest and digest. You know how so much, doctor, we're in fight or flight. I'm not sure why, especially I think living in the Western world, we just have this strong work ethic, which is not a bad thing. It's just intense. I think the word is we are just always going, and that's always putting our systems at a really high level of fight or flight. And rest and digest is super necessary to put your body back in repair. And so Aeon really does that. And I can actually feel this, like just chilling my system out. What do you think about this Aeon and X39 in combination?
Yes, I think it's the best combination. And that's why when I talked to Marci and we put together some of our silver pack, basically packages, I always have X39 and 49. We haven't talked about that one yet. And Aeon, I always want those three as a base for the patients. And Aeon is very much working in synergy. I like the turbocharge idea.
Let's talk about that. The pain and repair protocol in your order form, which I'll show at the end of the call, but you said it had X39, of course, the stem cell activation patches, Aeon to reduce inflammation, Icewave for pain. And then you talked about X49. What's that, doctor?
So X49 is the other stem cell patch that we have, in addition to X39. And X49 helps to stimulate the peptide AHK copper. And AHK copper, starting to get a little noise on my end. I'm going to move here. Sorry about that. AHK copper, again, is 3 amino acids. And it's just, we change one from the GHK, the glycine, to the AHK, which is the alanine. And so it's just another pathway, another super important peptide that I'd actually never heard of until I heard of it from David Schmidt. And it helps to stimulate a little bit more the performance, the recovery from performance, burning fat into muscle, all the things that pretty much every American wants, right? And it's another regenerative patch. So I love the X49 and putting it in combination. It's very helpful for my patients for more energy. Both X39 and 49 help with sleep. Even though you get more energy, you also get deeper sleep. So it's a wonderful combination.
You know, and I love X49 because like X39, it's a stem cell patch, but X49 builds lean muscle mass and grows bones, where X39 is going to turn into whatever cell your body needs for repair and does really good with collagen, connective tissue, and reducing scarring. So for a pain and repair kit, I totally see where you would do X39, X49 to repair muscle, skeletal, all the stuff that's going to make your body hurt, Aeon for inflammation, and Icewave for pain. So that totally makes sense, Dr. Patty. I love that combination. Moving on to glutathione. Now that's a very different type of patch than what we've been talking about. What's glutathione, and how is that kind of different from some of the other patches we've been talking about?
I think glutathione is one of David Schmidt's greatest contributions, because glutathione is a very hot topic in functional regenerative medicine. And we know it's probably our body's biggest antioxidant and detoxer. So we know we need it. The problem is, how do we get it into our body? And so all of the different supplement companies make different types of glutathione, and we have glutathione IVs, IV pushes. We have it liposomal under the tongue, and it's all a little bit harder to get into the body, and it has a short half-life once it gets there. When I found out that the patch didn't actually have glutathione in it, but it stimulated my glutathione pathway, that, by the way, I've done some genetic testing on myself, and I know that glutathione pathways, there's several of them in the body, don't work very well for me. I was excited because I've never been able to take glutathione. It makes me very weak when I would take a supplement. So I started the glutathione. I started it slowly. I could feel a little bit of that weakness, but not much at all. And I just started with a half a patch for a couple of hours, and I've now built up. I take it 12 hours without a problem, about 3 times a week. And that's basically what David recommends. You don't have to do glutathione every day. And it's a super antioxidant and detoxer. And that makes me feel really like I'm doing the right things for my body when I use it. No glutathiones in it, though, just stimulating our own body.
So I like to say glutathione is your master detoxification pathway and your master antioxidant pathway. So it's like, it's no joke. And when Dr. Patty says you could detox, that would be this patch. And so the great thing is, when Patty said she started slow, you can do half of a patch. Please don't cut it. You just unsticker half. If you cut the crystal, it doesn't work. So you would just wear half a patch for maybe 3 hours a day. And then the next day you could wear the other half of a patch. And Dr. Patty explains how you can, with any of these patches, but particularly glutathione, titrate your way up. Glutathione is the polar outer of all yuck. Going to pull it right from your nervous system, your spine, virus, bacteria, mold, toxins, Roundup, chemicals, metals. It pulls it up and out, and you're going to either push it out through your skin, through urination, defecation, and sometimes you could get a little nauseous or a little headache. Because we are super toxic, and that's why you definitely want to titrate up on glutathione. In fact, someone asked David if children need any of this, and David said 20 years ago, no. But today, because our world has gotten so toxic, that he would recommend X39 and glutathione for our children today. And that makes sense given what this does to pull out all the toxins. He even said, boy, if you start X39 when you're 20, you may never get a wrinkle. Can you imagine? I wish I was 20 when this was out. So that is glutathione. And we also have 2 others. We're going to talk real quickly about them because I do want a moment to show how to set up an office. But Alavida and SP6, I just started wearing SP6 after you started talking about it, by the way. It's new for me. So why don't you tell us a little bit about Alavida and SP6? We'll end on these 2 today, Doctor.
I use Alavida at night, and I do think that it's wonderful for skin, for the countenance of your skin, for lightening those dark spots that sometimes we get as we get older. Alavida also is very relaxing, and I think helps produce deeper sleep. So I love that one. I also use the Alavida kit, which has the day and the night cream. Super simple, very reasonably inexpensive for what you get. And I love it. So I'm recommending it to my patients now. And I think the SP6 for me is great because I have sugar addiction. And it took about 2 months of using the SP6 about 3 times a week before I felt any difference at all. And once I felt that difference, that craving for sugar went away. I go to the grocery store. I'm not fighting with myself down every aisle that I've got to go get the cookies or the cake or whatever. I'll leave the grocery store now and think, I didn't even think about it. And I've had many patients to say the same thing about SP6. So if you're using it or want to use it, give it a little time if you don't feel something right away, because maybe that just a little bit later, it will take effect. And SP6 does support our hormones and many other important things.
Well, and I have food sugar cravings, I have hormonal issues and digestive issues. So when you talked about those 3 with SP6, I'm like, to myself, I'm like, why haven't I bought that yet? And so I'm looking forward. I just started it, like literally, like I think today's my 2nd day. So I'm excited to walk down the food aisle and not want to pick up sugar. I can't wait for that day. So this is SP6, and of course, Alavida. Most people wear Alavida at night because you wear it right between your eyebrows, which if you wear it during the day, people will think you're a dork. So you might want to wear it at night. But what you do is it literally reduces oxidative stress in 5 minutes, just like glutathione. So those are both powerful antioxidants for your body. Alavida, in addition, builds collagen like X39. So you'll find when you start wearing Alavida, you'll get the tight jaw, the turkey neck will go away, your skin will start to be bright and glow. It's one of the most beautiful patches. And when I saw the video on Alavida where he said that within 5 minutes, he did this energy scan, the energy of someone went from dark purple with holes in it to a beautiful turquoise, like this color. That's why he made Alavida this color, is because that's what your energy signature looks like when you wear it. I'm like, I want to look like that. That's pretty. I mean, it's not so hard. Colors tell 1,000 words, right? Who doesn't want to look turquoise? I mean, it's gorgeous. So anyway, that's Alavida. So with that, I'll just quickly show you what doctor asked me to make her for the offices. So first of all, you would want to show your patients startx39now.com so they can educate themselves on the stem cell activation patches and all of our line. And like, this is Dr. Lisa Croft. She's a pain management doctor, MD, and she did a business card with her scanning site so people could order, and also the Now site. And what she does is she actually has a practitioner bag that looks like this. And inside she has these little baggies filled, and she usually has a little pop the spot in there. She puts 1 Icewave and 1 X39 in these bags. And what she does is she explains to her patients how stem cell and Icewave work together, why they need it as a form of stem cell activation and pain reduction, and that is an alternative to the expensive injections that people have been talking about. And so then she will put them on a silver protocol or a gold protocol. And then once they order, she will do patient education. And before they leave the office, she will put 1 set on them so they know how to do it themselves, like a patient training, which I think is really great. So you can go to startx39biz, that's startx39biz.com, and you can see where you can order these from. So first of all, if you want to order the business cards, you just go, we just added this, tools to promote your business right there. And you can go right to marketing tools, and you can open that up, and there's the first business cards you could order. And there's Sally, our designer and printer. You just call her to order. We also have so many other tools for offices, and just go down. Those are the envelopes that we explain. I like to call those our gifting brochures, that explain the X39. We also have stat cards for offices. A lot of the offices love these cards on every different patch. And then these are benefits and placement. So you can see there's a lot of materials here that you would be able to look for. Here's our X39, X49 trifold. So Sally has so much, it's right there now. And then you can also order a practitioner bag, and that will also be at the top of this site. I just haven't got it there yet. So to get the practitioner bag and also the order forms, you're going to go to the 14 steps of success. That's the first tab. Click on that. And you're going to go to take the order, tab number 9. Just write this down, tab 9. And then the order form that Dr. Patty likes is, for example, the Silver Kit order form. And it breaks down the different protocols. There's her pain and repair, her detox and brain, her skincare, her sleep, and her hormone and digestion. $2.99. The retail value is $4.59, so it's a great price. And then she always puts her clients on 1X39 the following month to keep their stem cells activated. And then she allows her clients to be able the second month to just do that or pick and choose and add to their auto ship. Now, know that when Dr. Patty fills this out, she gives it to her assistant who puts it in Dr. Patty's back office, and then Lifewave ships it to her patients like Amazon, and then Patty gets a thank you check for providing it, but she doesn't need a ton of inventory. She's just submitting the order, and then the Lifewave actually processes that order, which is really, really great. So then the other form that and there's a gold form as well, which is $4.99. And then this order form right here is just you build the pack yourself for your client, knowing that 1X39, 1X49 equals any 2 supportive patches. So there's a few different order forms that work really good. And then you may say, well, how do I tell my patients what to fill it with? Well, we love the 1 page, and that's right below. And that just explains all of our patch technology. So you can work with what your patient needs, to fill, the toolbox has this in it. So then lastly, my doctors go to tab number 6, give a gift. And this is where you could order the gifting bag. We call it the gifting bag, or the practitioner bag. And you can set up these envelopes. Here's the little baggies where you could put some pops in to do patient education. And Jan Rand, you can call Jan or email her to order that. And that's really how we set up a practice. Let's just say that one more time. Most of our doctors have a business card. We call it a business educational card. They have a practice bag. They have they have 10 order forms, and they have 10 1 pages. And that's how they make sure everybody's set up. So it's pretty simple. And if you have questions, you can go to startx39biz.com, and you can ask Jan Rand. She'll be of service for you if you need her. So with that, Dr. Patty, any other closing remarks before we end our call today?
No, it was just great to see everyone, and I look forward to just being on this path with you.
Thank you so much for your education and your support, doctor. It means so much to all of us. We're helping so many people. Have a great day. We'll see you next Thursday at 9 a.m. Pacific. We hope that this was a benefit, and we will talk to you later. Bye-bye.
Love you, Mars.
Thank you.
Thank you.
Hello.